Well, good day, everybody. This is Chris with the Ancient Scholar. It is another week and another middle of the night shift, and I just cleared the last patient from the clinic. I've got a few things cooking at the hospital right now, so to speak, but I do have a little bit of an interlude, and I thought what I'd do is make another video and continue on the theme of oncological emergencies that may actually manifest or may actually be appreciated by the pre-hospital provider. So the next oncological emergency I want to talk about is a condition referred to as superior vena cava obstruction, or SVCO, and this is a constellation of findings that occur with obstruction of the superior vena cava, so on the right side. And this can occur in one of two ways. The first way is if a blood clot forms or a thrombus forms that causes an occlusion or an obstruction of the vena cava. That can certainly do it, and we know that many patients with oncological issues are going to be hypercoagulable and more prone to developing clots. And the other way is due to the mass effect, essentially the space occupying lesion that occurs typically as a result of a metastasis of the tumor of cancer. And there are two primary culprit cancers or categories of cancers that are most likely to cause obstruction of the superior vena cava. The first is non-Hodgkin's lymphomas, and then the second are the small or oat cell lung carcinomas. All right, so those are the major risk factors. So what happens when we have obstruction of the superior vena cava? Well, a few things happen, but primarily what we run into is you run up into a backflow of blood, and essentially what happens is all the blood that is draining out of the cranium, the face, head, neck, within and outside of the cranium is going to be obstructed, so that venous drainage out of the cranium is going to be obstructed. And so what that's going to do is that's going to cause a essentially swelling of the face, and you get this plethoric appearance where it's kind of this redness, swollen, rounded appearance, and you can get, in severe cases, cerebral edema. And so this can manifest with altered mental status, seizures, even coma and death in severe cases. This also tends to cause jugular venous distension, as you have that increased venous pressure. Dysphagia can also occur, and you can tend to get some swelling, particularly in the right arm. And there is something called the Pemberton sign, and you get a positive Pemberton finding or Pemberton sign. And essentially what happens is when you raise the arms above the head, that plethoric appearance worsens, and you get increased swelling. So this is potentially something that you can clinically appreciate as a pre-hospital provider. So once you identify this, or you have a strong suspicion of superior vena cava obstruction, how are we going to manage this? Well, we don't have the ability to definitively manage this, but we can recognize the risk factors, recognize the red flags, or the key signs and symptoms or findings, and initiate rapid transport to appropriate healthcare facility. In addition to that, we can administer oxygen, because sometimes these patients can get dysphagia, and they can get dyspnea as well. And oftentimes the culprit cancer is a lung cancer, i.e. small or oat cell carcinoma. We may need to administer benzodiazepines to control and or prevent seizures. You want to loosen any clothing, so if somebody has maybe like a tight turtleneck or something like that, loosen that clothing to facilitate the best venous drainage you possibly can. Right, so seat collars and things like that are not going to be very helpful in this setting. And there may be the possibility of administering steroids, depending on the service you work for, and if you have the ability to do this, although typically when steroids are administered, we need to administer very large doses of dexamethasone or decadron, which is not something that a lot of surfaces carry, and certainly not in the recommended dosing regimes, but it is a possibility in the pre-hospital setting. When it comes to more definitive care, typically these individuals are going to need a stent or a shunt placed to facilitate increased venous drainage. And that's, of course, something that we're not going to be able to do, but we can certainly support the patient and rapidly transport them to appropriate care. So that is a down and dirty presentation surrounding the pre-hospital implications of superior vena cava obstruction. Hopefully you all found this video helpful, and perhaps you may end up appreciating this in the field. And again, I hope this is helpful. All right, everyone, take care. Have a great day.